Good afternoon, Ms. Pope.
How are you?
Good to see you. I'm
You
good.
too.
How are you?
Good.
So it's great to have you as a guest for our e-journal.
Mm-hmm.
And well, the first question I'd like to ask you is, you're an experienced natural medicine practitioner with qualifications in nutritional medicine. You're also a life coach. What drew you to homeopathy?
Well, I didn't react well to Western medicine, shall we say. So after I'd had 2 children, I was looking for some other options. Basically, because I was working full time, I was really busy, and unfortunately, when you have young children, they get sick all the time. You get sick, and every time they gave me something like antibiotics or, on one occasion, even Stematol. That was not good. I ended up with quite bad reactions, so I started looking at options. And the first one I looked at was just naturopathy with herbal medicine, but I also find that I'm quite sensitive to herbs and I really don't like taking them, whereas I seem to respond really well to homeopathy. So that started my interest. And also I had a fabulous naturopath who used a lot of homeopathy, and he gave me belladonna for a child's ear infection. So my son had had these recurring ear infections, and I remember giving it to him, and then like giving him another dose, and 10 minutes later he rolled over and went back to sleep. And it was like, wow, okay. This seems a lot better than the trip to the medical centre at 1 o'clock in the morning, So that's what really promoted my interest in homeopathy.
Okay. So being the head of department of homeopathy at Nature Care College, what is your assessment of the status of homeopathic education in Australia?
I think at the moment, most of the courses, we have some similar trainers between all the courses, so the students, wherever they're studying, are going to cover similar material. We actually have a health training package around Australia that says, you have to cover these things. I think one of the things is we probably need to get a lot better at training our students to treat what I would call acute conditions. I think probably the courses we have tend to focus very much on a kind of classic homeopathic model, which is great if you've got the time and you've got patients who are prepared to do that, but I think it would be good for them to have a stronger acute focus. It would also be great because then perhaps we could see it used more in, perhaps not in hospitals, but certainly maybe in pharmacy or other areas, which I think would actually really help with promoting homeopathy to the general public.
Any government institutions that are teaching homeopathy?
As in, if you're talking hospitals or organisations like that, no, there aren't. There are private universities. There's a couple. I won't mention them because I work for a competitor, but there are a couple of private universities. There's no government-funded courses in homeopathy that I'm aware of, and I've worked in the industry for quite a long time, so I would be aware of them. But that's probably the case. There are only 1 or 2 institutions that are offering naturopathy through a government university too, so there's just not that access with natural medicine in Australia.
Okay.
And yes, it would be lovely if it changed.
Yes, of course. I'd like to see it to be upgraded to a full medical degree rather than a vocational course.
Yeah, I think that's it's probably a little way off here.
Yes, I guess so. In the age of super specialized healthcare, what is the relevance of homeopathy?
Well, I think homeopathy is an amazing way to practice with people, that you can work holistically with them on a whole range of their health problems, because I think specialisation, in a sense, it starts treating people like they're their knee or their shoulder or their stomach, rather than looking at the whole picture and what's going on. And that's where I think homeopathy has a huge role to play. And the number of times I've treated a client with a particular homeopathic medicine and seen significant improvement in all their health, and you can't achieve that when you're just treating bits of them. But in terms of a specialty, in terms of specialising in homeopathy, it's actually quite a tough profession here. There are probably, we have a lot of women who practice part-time, and probably only a few people who really do practice full-time as practitioners. And I think we need to shift that to actually get it to be accepted more broadly.
So would you say that your understanding of homeopathy has helped you become a better holistic medicine practitioner?
Oh, definitely. I mean, just the questioning skills. And I find it's even when I'm in nutrition clinic, I have to really watch what I'm doing, because I it's like, okay, so just modalities, what makes you better and what makes you worse. I'm absolutely fascinated by that, and the nutrition students, why is she so interested? But to me, it's that whole picture of what's going on for someone.
Right. Is homeopathy included in the National Health Policy, and is there any insurance coverage for homeopathic treatment?
Well, in Australia at the moment, we have an Industry Skills Council that sets up a health training package. So that is basically endorsed by government, and that's across the range of a whole, anything you can think of in adult education. There will be a particular package that specifies what you have to do and the levels of competency.
I see.
In terms of, sorry, what was the second part of your question?
I was talking about the insurance coverage.
Oh, okay.
And the National Health Policy.
Yeah, all natural therapists are registered with associations.
Okay.
And while that isn't a government mandated operation, as part of your registration, you have to have insurance. So we have a number of, that's usually arranged through your association, as well as maintain currency of your first aid certificate and ongoing professional development. So those are part of maintaining your registration, but also insurance. And this also then gives you access to, so we have private health funds that will give their clients a rebate for seeing natural medicine practitioners, but only if they're with an association and they meet those other criteria. So it does provide people with some benefit, but no, there's no government funding of homeopathy here.
Okay. In terms of patients getting any insurance coverage?
Again, it's through private health. We have private health funds, which are they're a for-profit health fund. So you would have a range of cover with them, which would include hospital as well as what they call ancillaries, which sort of means alternative health. So it could be physio, it could be chiropractic, it could be optical, that sort of thing. And it really very much depends on the health insurer. But there are about 50 different private health insurers in Australia, so most people that I see would have some level of health fund coverage.
I see. What are the challenges faced by young homeopathic practitioners who are starting out in Australia?
Well, the first challenge is the same as homeopathic practitioners everywhere, which is homeopathy is tough. You never feel like you know enough. So I think, if you're a young practitioner, it's also that confidence, feeling that you really know your materia medica and you absolutely know what you're doing, and still waiting to feel really confident. But with a lot of other things, I think it's the fact that they actually don't have a hospital, an internship and a process for them developing their expertise. They really have to go out and set up their own practice, and that means they have to become business people as well. So it's a dual challenge, and I think that's quite big. And we are getting to the stage now where we have more clinics that are 5 or 6 practitioners, so that they can take 1 or 2 students at a time. But there's not enough of those sort of clinics to really mentor up the next generation. And I think any young homeopath, they should find a good mentor. And I was really fortunate because I've had a few, particularly a lady called Debbie Rayfield who had run a hospice in India for a number of years, and she was wonderful. And I basically sat in clinic with her 1 day a week for a year after I graduated, and that was far more invaluable than anything else. Although she was a bit tough, she used to put you on the spot and say, right, just finished the case. Okay, what do you give for that? But it was good. It was good training.
Yes. So, from your experience as a practitioner of homeopathy, what would you say are the key areas in healthcare delivery structure where homeopathy can contribute the most?
I think it has a really major role in terms of anxiety and depression.
I see.
Mental health certainly is a huge challenge here. We probably, the government says 1 in 5 people will suffer from mental health problems. And certainly the number of people I've seen who have managed to use homeopathy rather than, mainstream medicine, Xanax, Prozac, whatever you want to call, it's amazing the difference it can make, and I think that's a big area. I also think in terms of just general preventative health, I think this is another area where homeopathy has a huge role to play. Because if you can bring a child up on homeopathic medicines, then they're not having lots of antibiotics, the gut's not getting decimated by the antibiotics, they're much healthier, they don't need anywhere near the same level of intervention. To me, if I can do that with all my families, I'm happy. I think that's a big improvement.
And what about lifestyle disorders and geriatric care?
Certainly, Look, I find it can be quite tough when you get patients who are on 7 and 8 different medications. Sometimes you don't really know what you're treating. But I think if you can get them before that, you can certainly get them using a lot of homeopathic support rather than actually relying on other medications. And I find you can also wean them off a few medications with their doctor's approval and, support, of course.
All right. So evidence-based research is the cornerstone of medical science. What is the status of research in the field of homeopathy in Australia?
Look, it's emerging. There's a project called the Aurum Project. Again, one of the groups of homeopaths I'm talking about, she actually has a student doing research using their case files. She's published some pieces on hyoscyamus. She's also been looking at children's ear diseases and things like that. So pulling together, so rather than, there's lots of individual case studies, it's getting to that next stage of saying, okay, well, here's a number of cases, here's a case series,
yes.
Here's other evidence. But, we don't have an academic structure that's actually supporting the development of homeopathic research at the moment. And I think that's probably more of an issue internationally too. Because again, I think there are a lot of homeopaths practicing, it's their own clinic, it's what they've got time to do. And it's not being paid or funded, so it's just something extra you do because you love it. Like there's a homeopath here called Isaac Golden, and he actually did his PhD in homeoprophylaxis. Okay, but that was 15 years work of his, and yeah, he did it off his own bat. So you have to be quite motivated. I mean, I think most of the good research, and Isaac's now actually working with the Cubans on a lot of research too. So at least now that's got some government support there, and hopefully we will see more research in those sort of areas. But I do think, look, the whole challenge with evidence-based practice, and you've hit me on a subject I really like because I teach it, but mainstream medicine is actually not based on evidence-based practice at the moment. When the Cochrane collection was set up, only 15% of interventions were actually met that standard, that gold standard of the randomised clinical controlled trial. So it has improved significantly. It's probably at around 35 to 40% now, but there's still a long way to go. And of course, who's going to run a trial on aspirin because you use it all the time and you know what it does? Well, to a certain extent, I'd say that with homeopathy. Do we really need another clinical trial on belladonna? And, there's always people doing provings of new remedies. And that's an area I think in Australia that does get a lot of research, but probably doesn't meet the evidence-based parameters. I don't think they quite know where to put proving.
Okay.
But
we do know that complementary medicine forms a sizable segment of the health industry, with Australians spending almost $4 billion annually on alternative medicine. How can homeopathy be made more popular amongst patients who are choosing complementary therapies?
I think what we really need is better access to homeopathy. And one of the things I noticed they do well in New Zealand and Europe and England particularly is that you can go into a homeopathic pharmacy and go, I've just got off a plane and I've got jet lag and I feel like this, and someone will give you a homeopathic medicine for it. And it's great that, if you can get that access, you can have those sort of little experiences that will then encourage you to go and find out more about it and go and see a practitioner. Because it's not easy to access, that kind of acute care. So I think that could be the first step. And often when I've done, we have a lot of, I was going to say expos, I don't know if you sort of, but basically it's an exhibition and it might be for the health industry or something. So we'll often go along and run something similar at those sort of functions. But I think what we really need to do is have, I know in Wellington and in Auckland, for example, I mean New Zealand's quite a small place, but they've got homeopathic pharmacies in there that you can access. And in fact, I buy a lot of my medicines from them because I can ring them up and go, I'm looking at this, should I be using X or Y? Like their staff is so experienced that you can, get some more information from them as well.
I see.
So I think that's one way that we could actually improve, it's educating people about homeopathy and what it can do.
And better access to medicines.
And better access, because you have that first experience of arnica or hypericum. I had a client this week who came in and she works for a major health group. And I'd given her hypericum because she'd had a fall and injured her coccyx.
I see.
And she was in quite a bit of pain when she came into my clinic. And even there, sitting there, she found the hypericum really helped. Anyway, she didn't follow my other advice, which was to go and get some structural work done. But she did say that she was taking the hypericum and it really made a difference. But she ran out. She went downstairs, they've got a massive, it's lots of supplements and all this sort of thing. And
yes.
said, have you got anything like this? And they said, oh no, we don't have hypericum, we've got something similar. And she said, didn't do anything. So she was so impressed with the hypericum.
Oh, that's nice to hear.
And it's those experiences that
right.
really help people's mind shift about, oh, okay, this is really dilute and I really don't know how it's working, but wow, it really helped me. Yes. I love that campaign in the UK. They're doing Homeopathy Help Me. It's really
yes.
simple, but it's actually, at the core of what you do as a natural medicine practitioner is you actually want to help people get better.
Yes, absolutely. What are the requirements to be fulfilled by a foreign national to start homeopathic practice in Australia?
At the moment, you'd have to contact our registration board, which is not a government body, it's independent, but it's called the Australian Register of Homeopaths. And they can, either they'll recognise your current qualifications, it depends on where you're from, or there's a process of sitting an exam to demonstrate competency. So I think, I know there are a number of Indian nationals who've moved here and practice, so I assume that most of the time their qualifications were recognised. Most of them are doctors, so I couldn't answer that question about what a doctor would have to do to be recognised here as a doctor. I only know one. But I'm assuming it's a process with exams, etc. And Arrow are actually very helpful. I know a number of people who've gone through that process having moved here and found that, although they're a little bit confronted with the idea of having to sit an exam again, I think it's pretty reasonable.
Arrow being the Australian Register of
yes.
Homeopaths.
Yeah.
Yes. So in recent times, homeopathy has come in for some very harsh criticism from government agencies and scientific community. What are your thoughts on the future of homeopathy in Australia?
Look, I think we're always going to be a bit under the gun as a complementary medicine because it's hard to figure out what's going on with homeopathy, and that's what people struggle with. It's how can something so dilute have an effect?
Right.
And that fundamentally challenges the whole paradigm for scientists, that I give this much and it does this, and I give more and it does more. It's like I'm giving less and it's doing more.
It's
going to challenge them. But look, I think the recent National Health and Medical Research Council, I don't know if you've seen that report, but their review of homeopathy, which I was involved in submitting extensive homeopathic research. Basically, we mind the European Council of Homeopaths have a great section on their website with all the recent clinical trials, etc., etc. And their report, I thought, was very
negative.
It was negative, but it was also very, very poor analysis. Because what they did was they said, okay, we're going to exclude any study with less than 500 participants. Well, it's homeopathy. Most of the time we're funding it out of our purse. How many studies do you think are going to be over 500 participants? Unless it's maybe a homeopathic hospital in India. So pretty much, they could look at some of the research that, say, Brouwer or Boiron were doing in Europe, except no, they wouldn't look at studies that weren't written in English.
Oh,
okay,
surprising.
So those two criteria, what are you going to be left with? It's like, it was almost, and the thing is, they didn't tell you what the criteria were before they published, which, to me, that's a fundamental. When you're doing a trial, you say, this is my selection criteria, this is what I'm going to look at. They didn't do any of that. So to me, that's kind of weak science. I think they should be judged quite poorly on the outcome. It's an easy headline for media, unfortunately.
Right.
But I think, really to me, it's like, okay, you fundamentally, and we also submitted a number of names for homeopathic experts. They wouldn't have anyone on the panel who knew anything about homeopathy.
Oh.
Yeah, I know. Sort of interesting. And so to me it was a foregone conclusion, their result. And it probably wasn't as negative as it could have been. Which isn't really a great outcome, but I think you've got to look at it in the context of, again, homeopathy is a very hard thing for scientists to understand.
So do you think that's going to have a negative impact on the future of homeopathy in Australia?
I think the biggest thing they were concerned about was that private health funds would withdraw their coverage.
Yes.
However, the thing that a lot of people are concerned about, they're forgetting that private health funds provide coverage of these services because that's what their clients want. There's some wonderful research coming out of Glasgow Homeopathic Hospital that looks at long-term research about people who use homeopathy. And they looked at about 7,000 people, and you know, it was written in English, so they could look at that one. But they looked at about 7,000 people, and what they found was that people with chronic disease were feeling better with the homeopathy at a lower cost than other forms of intervention. And I think we all know that people with chronic disease usually don't feel better. They might be maintained where they are or gradually get worse. So I think there's actually some pretty good research to support the use of homeopathy. I think it's just hard to fit it into those sort of mainstream trials.
But then there's always the placebo effect googly to be thrown in if there's anything positive coming out.
Yeah, I know. You can always throw placebo effect, but a lot of modern medicine relies on placebo effect too.
Yes.
And I do think there is one. I think in Australia, one of the things we do is provide a space for our clients. You know, like it's an hour where someone can come in and actually have that focus on themselves. And I think that it cannot be underestimated that that is very powerful for our healing because so few people actually get heard.
Right.
So, you know, there is, I wouldn't call that placebo response though. I actually think that has to do with actually, you know, even if you become aware, oh gosh, yeah, I am really stressed and I am doing a lot, and maybe what I need to be doing is a bit less of this and a bit more of that. Even that sort of shift can make a big difference to people. So, you know, I think that is one of the benefits. I think it's very hard to analyse that benefit. Although I do know that with counselling, 40% of counselling is effective regardless of the counsellor. So perhaps we can attribute that percentage. It's tough. I don't know how you design a study around that. But I do think that is one thing, because, you know, in Australia, because most homeopaths are practising more from a classical perspective,
Yes.
that is probably a point of difference.
I see. So finally, what is your message to young homeopaths around the world?
Keep studying your materia medica. Learn as much as you can from mentors and keep practicing, because I think longer term it will be shown that homeopathy is truly an effective medicine. We already know that, but the rest of them will catch up with us.
Thank you very much. It was
You're
a pleasure
welcome.
having you here.
Thank you.